that. Can you see that?
Yes.
Yes.
Yes?
Yes.
Very nice.
Now.
Mm-hmm.
So anyway, we are big supporters and big fans, Laura, and I'm going to turn it over to you, and thank you for joining us today.
Yeah, thank you. That is so kind. I think I do believe our staff does feel very appreciated by our community. So thank you for all the notes and letters. We've gotten many. You sent out an email, and we've gotten many, many letters of support and encouragement. And actually, we've been fed and supported in letters and chalk drawings and proclamations, Mr. Mayor, and in so many ways. And honestly, it does make a difference. You know, it does help our staff. In the beginning, this was obviously very frightening for everybody. I think we've gotten to a point today where we really have processes and organization and structure and equipment and protection that really helps our employees feel very safe. Although it continues to be an insidious little devil, this virus, and surprises us at different points to remind us that we have to be really ever vigilant. I'll give you a really quick update. To date, the hospitals had 4 patients that were hospitalized with coronavirus. 2 of those have been discharged home. One of them is in critical condition today. Well, 2 of them are in critical condition today, one in Winston-Salem and one in our intensive care unit. So the past few weeks, we've really seen a ramp up in people presenting with symptoms, and we still operate our respiratory diagnostic center at the Quest for Life parking lot there. We had 50 people go through Friday. That was kind of back up to the starting number that we had. With a little bit of a regional outbreak coming from a plant in Wilkesboro. Interestingly, you know, a third of the people who have been infected with the viruses are completely asymptomatic, so they have no symptoms. You would never know it. That's what makes it kind of tricky. And then the folks in the middle who get mildly ill, and then the people that get sick get really, 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 really sick. And it doesn't seem to make sense who, when, where, or why, to me anyway. But we have every place in the organization, we have kind of triage protocols. The minute you come into contact with any of our facilities, you're asked some questions and immediately triaged down one avenue or another, depending upon what you present with, and so that we can make sure that everybody is safe. Everyone wears a mask from the minute that we come in contact with you till you exit the facility, and all of our people are protected too with masks and equipment. So it's been a really interesting time. You know, one of the biggest challenges, of course, you read all this and see it in the paper, but it's true here, is getting testing results promptly, and that's been one of the critical issues. I feel like we've done a really good job in this community with our testing. I think we're the only center in the region that has a diagnostic center. And one of the advantages of that is people don't hang around and wait and say, well, maybe I'm not sick, maybe there's nothing. I mean, they feel pretty comfortable just to come to a drive-through, figure out if what they have is a problem or not. In the beginning, it was hard because we had like 2 weeks till you got a response. By then you would be cured or sick. So it wasn't totally helpful, although it did allow us to counsel people to stay at home. Today, we're getting turnaround times at the RDC up to two days, sometimes shorter. We do have testing at the hospital that takes about an hour. So that's good, but very limited supply of that test or ability to run that test. We run it at the hospital, but we just don't have enough equipment yet to run very many of those tests. And so people who present to the emergency room, they're tested immediately. People who, any employee or doctor, anybody who has symptoms, are tested immediately. We're using that testing for surgical patients because we did start to ramp up what we call time-sensitive elective things where it really benefits people to get in. We're a little concerned that people are staying at home and not coming in with chest pain and not coming in with stroke symptoms and not coming in. and are getting sicker at home because they're afraid. So we are trying to share with folks that we have safe processes, and if you have something you really need to come in, our diabetics, everyone. So with surgery, we're testing people prior to surgery, so no one will come into our surgical areas without having a negative COVID test. So we started this a week ago, and we already had one asymptomatic person present for surgery. Absolutely no symptoms or any reason to think they had it, and they did. So of course, we were able to postpone surgery on that individual. We also, so it's a vigilance issue. We had someone drive up to the ER and need help getting in, and our staff were all gowned and prepared, went out and helped them, but didn't mask them. So we're still, and they turned out to be positive. So we still have, areas we're trying to lock down, mitigating risk for everybody, but it's a very interesting time. One of the things that we're working on right now is we recognize that businesses need to get back to business. And so for the past week, I've had a team of people who have been calling local industries, all the major industries, and asking them, how can we help you? What is it that you want or need to support a safe return to your workplace? And we have had a very good response. And so we're looking at setting up through our HealthWorks program, which is our occupational medicine service line. We're looking at setting up some protocols and support for industry to do COVID testing and antibody testing of employees so that, we can help in any way possible for our businesses that are getting back into place to be as safe as they can possibly be. Antibody testing is tricky because it will tell you if you've been exposed. So we'll find out people will have been exposed and they're not contagious, but we're not 100% sure if that means it will prevent an infection in the future. I think that's kind of the scientific answer, because scientists like to have meta studies and full proof. The history is of coronaviruses is that they tend to create immunity. And we have no evidence they don't create immunity, but we don't have evidence they do because it's a little bit early to prove that scientifically. So, but we have developed relationships with the Mayo Clinic, and we're going to be doing we're already doing coronavirus testing, but we're going to do antibody testing with them as well and offer that. Those are the main two services it seems most of the industries would like to see. And we will be working really hard to access the testing supplies and testing reagents and the access to testing for companies who approach us here in the region, not just Caldwell County, but in the area.
So can you talk about the models that you're using right now and what you see in your medical crystal ball for the virus?
Oh, our predictive models? Yeah, we're working with UNC Chapel Hill epidemiologists, and they've done some very sophisticated modeling of what we can expect from a disease prevalence point of view. And what all of our models show is that, and you see this probably on TV and hear it, the curve has definitely flattened. We're not seeing that exponential curve. It's very flat across the state. It's very flat across UNC hospitals for the past week. But what tends to happen is there's a flare up in a specific location, like a congregate living facility, a prison. We have some real problems in our hospitals that are in prison area where there are prisons. And in some meatpacking plants. So across the state, that tends to be. So it's a little bit hard to predict individual hospitals because it depends where a flare-up occurs. But basically, the predictive modeling says we're plateaued, but we'll just slightly increase. So for example, it suggests by next Monday, we'll have 6 patients in the hospital. And it suggests by July 22nd or 20th, look at my calendar, but the third week in July, that we'll have about 22 people hospitalized. So it is a continued rise. It's just not exponential. So, and kind of giving, if a flare up occurs in our hospital, in our region, what they're seeing is you can go from 0 to 100 pretty quick with cases. So that's the critical factor, is trying to prevent flare-ups. But if you kind of do an average across the state, look at how it's going across the state, and kind of equally distribute those patients by scale and size, our hospital would have 22 patients in the late July that are COVID positive.
And how does that meet with your capacity to deal with that number? Is that a comfortable number?
Yeah, it is. I think there would be somewhere between 6 and 8 critically ill people out of the 22 who would be intensive care, according to predictive modeling. And we have a 12-bed ICU. We have 14 ventilators. We have a unit set up that is basically 30 beds that can be converted into COVID without overflowing into other areas that are all negative airflow. If you drive by the hospital, you'll see wood paneling and filters coming out of the rooms. We had to modify the windows and everything, but we can meet that capacity. We have what we need to take care of that quantity of people. Thank goodness. The original projections were overwhelming. The original, if we had not done social distancing and we followed the exponential curve that was occurred in many places across the world that did not have the opportunity to social distance before there was significant spread, we have models and plans to convert spaces that aren't hospital spaces into hospitals in our county. So thank goodness we are still in what we call tier 2. We have tier 3 and 4 plans, and barring some major change in the dynamics, then we should be fine.
So I'm putting you on the spot. How long do you think this is going to be with us?
I can't imagine that it won't be with us for a year. It's a feisty disease, and from my, just from a personal perspective, I'm going to protect vulnerable people for a year, because there's not much we can do in truly in the treatment, and there's not any real predictability about how hard you're going to be hit if you get hit. So I think that from a social point of view, we have to think protection and think safety for a year. And then it's going to be probably related to getting vaccines and maybe some treatments.
I know that we probably have some folks who have some questions that they'd like to ask, but before we do that, I also want to ask you about the mental health facility. You cut down some trees and removed the construction trailers, and it was like, voila, amazingly, this beautiful mental health facility is sitting up there on the hill. How's that going, and how is that working with the timing in this situation?
We have a great contractor who is a local contractor in Looper. They've done a really, really good job, and they've kept us on track. We're 3 weeks behind, which is not much for a project of that scale. We're due to open July 20th. So assuming that all the furnishings come in without delay, and that could happen with the way distribution is running right now. But we're right now we're projecting and planning to open July 20th. We have hired psychiatrists and psychiatric nurse practitioners, and staff, and we're getting ready to go. It'll be a little bit modified from the COVID because it's kind of congregate living in some ways. So we have to only have private rooms, and we have some doubles, and we have to modify the eating and groups. We can't have groups. So there's a lot of things that will be modified, but the demand is not going to be modified. I can tell you that, interestingly, when this first thing started, we didn't see any people in crisis in our emergency room. But in the past week, we've seen that ramp up. So I think this has been challenging for all of us. And if you have a pre-existing condition, it's particularly hard. So I think the state is expecting a surge, in people needing acute care for mental illness this summer. So we'll be just in time. We're still battling with, I shouldn't say battling, but we're still trying to work with the legislature because they were really working with us to get the funding we need for paying for the patients that come there, a group of them, one group of patients. And they kind of are busy. So we're trying to regain their attention and get them back on track. One other thing I was going to tell you is that we're so fortunate to be part of UNC healthcare system for this community, because so much of what we've done has been driven right out of the academic medical center, and all their advice, the RDC, a lot of these strategies have come from really phenomenal, the people who do Ebola treatment in the world. These are the root source, and they've been giving us guidance. And we've also had amazing access that many other hospitals don't have to: testing, equipment, supplies. And on the treatment side, we've had access to, while we haven't had too many people to need it, all four of the have had access to some treatment options that aren't available in many hospitals. For example, you hear a lot about the blood transfusions of recovered patients, so convalescent blood transfusion. There is a limited supply of that, but all of our patients have had the opportunity to have convalescent blood transfusions from a clinical trial we're in with the Mayo Clinic in Rochester, and also have access to interleukin and some other major drugs and things that are hard to come by, but we have available all of them. So it's good.
So I don't know if if you're going to stay with us for our entire meeting. You're kind of like the legislature, a little busy yourself. But I did want us to have the opportunity for our folks to ask some questions. So if you have a question for Laura, if you would raise your hand, and Randy is here, and he'll look for that. And everybody's muted, but we'd love to entertain a question if somebody has one. Can't believe it. I'm looking at all those pictures and there's no question. Well, you must have done a phenomenal job, Laura.
Well, happy to help. Anything we can do. This is a real partnership across the entire community. And I'm telling you, it is a partnership across the community. Our nursing homes have done a phenomenal job. We have biweekly calls with them in the health department, and really have worked closely with them on strategies to help make sure, and they've done a great job in and of themselves to implement really good policy. Industry, I get a lot of calls from industry. We're trying to help as much as we can. Businesses set things up to be successful. And we've gotten so much from gifts. I mean, it's unbelievable. The masks, we got computers from Google, and they allow us to do virtual visitation and virtual pastoral visitation for all of our inpatients who can't have family and visitors near them. And that's been a huge success. We've received thousands of N95 masks from Blue Ridge. We got 24,000 face masks from McCrary Modern employees who just made those for us. I'm afraid to leave someone out because we had probably 100 donors. We had a cupcake group that sent us 900 cupcakes for all of our employees, and Blue Ridge has given us 1,000 cupcakes on Friday or Wednesday for Hospital Week. So thank you, Blue Ridge. And
you're welcome.
I don't want to leave anybody out, but because there's churches, and I mean, there's so much food, we've all gained weight, but it's been tremendous community support and partnership. And that's what will make us successful as a county and a community to get through this, is really working together and trying to take advantage of the collective power of our knowledge and ability and influence as leaders. So thank you all for everything.
So Laura, before you leave, can I ask a question?
Sure.
Okay. Yeah, I guess a big piece of this I'm struggling with because early on, we pretty much shut down, locked down our business, our employees to really protect and from a safety perspective. And at the time, it seemed like we didn't have a lot of cases, in our county. I guess without testing, we really didn't know, or throughout our area. And now, as things seem to be opening up, it seems that the rise in cases locally are increasing. So I'm conflicted with regards to trying to bring bring employees back, do more things, businesses opening and so forth. But at the same time, it looks like there's a, you mentioned it's a trend, but it is a trend up. It's not going down as we see the daily reports. So I'm just struggling from a safety perspective with regards to how we need to protect our employees. So any insight as we're opening up and the trend is up, how
yeah, it is tricky. I mean, the initial governor state effort was to mitigate exponential growth so that we would have the capacity when people are infected to care for them. So the virus itself hasn't changed a bit. It's the same guy that was here, and that's the tricky part. We have to treat it with a tremendous amount of respect because it continues to be extremely dangerous. But I think this is where very thoughtful leadership is important, because we need to think about how can we keep our economy going, because there are very serious consequences to not having a good economy. And yet protect people. And so to me, it's like we're still in we should be social quarantine, but economic interaction. And so helping people understand that the social part of this is still something you have to watch. You shouldn't be in groups more than 10. Truly, you should wear masks. I mean, when I wear a mask, I protect you. When you wear a mask, you protect me. And it does have a significant impact on transmission. And then whenever you go out in public, wash your hands as soon as you're done, anything you've touched. So, and if you have work sites, clean it's basic stuff, clean things, all the things that can mitigate spread. But I think that, the recommendation to keep people home, working from home as much as you can, no common spaces, reduce interaction, wear masks at work, wear masks in the public. People don't like to do that. It's awkward at first, but you do get used to it. Honestly, you do. We need to be vigilant. I mean, we need to encourage our people as leaders of organizations. We need to encourage them to be vigilant. You need to test. I mean, we do see quite a number of people who test out as having a fever when they come into work. And that protects everyone there. They don't even realize they have a fever. They might think they have a headache from a sinus, from allergies or something, and they test out with a fever and then and remove them from the workplace. I mean, those, entry point things and screening people out. And I think also as businesses, there's a stigma to this that we have to be very thoughtful about, because you don't want the penalty of losing your income and the penalty of stigma to prevent you from doing the right thing. And it really will. It will for people. So I know McCreary Modern, for example, they are, they want people to self-report everything. So if you are an employee, you have even if you're just a worry wart, they're saying, we will pay for you to drive to Caldwell. We'll pay for you to have the test done, and we'll pay you while you wait for its result, because I want to make sure that person doesn't feel like they have to come to work and to cheat the system to keep their income. So I think as leaders of businesses, we have to think about those things. And I know they have a cost, but the cost of shutting down your operation because someone came in because they didn't want to be, punished basically economically, you'll save a lot of money. And that's why some of the screening testing may be helpful as we get open, is because it'll make people feel comfortable coming forward and saying. And so it's a very nuanced leadership that I think we have to display here as business leaders. It's very nuanced. It's not just like back to normal.
Yeah.
And people are going to get sick, and that those numbers are going to go up probably because of the increase in social interaction as we go forward. That's in our model. Our model defines, it's got a factor for, a statistical factor for the degree of social distancing that you have. So, but I'm thinking about me and my family. I don't want to be in a statistic. I don't want to be there. So that's what we have to really teach people and talk to people about. I mean, it's hard if you don't understand how disease is communicated. To really teach all those things, but it comes down to a few basic rules, of what to follow. Does that help?
It does. Thank you. That's very helpful.
There's a question on the chat screen there from George Gutierrez. He asked, is the current model that you're using based on continued social distancing, or is it adjusted for the reopening of the state? And I think that you answered that a little bit there. I don't know if you wanted to add to that.
No, it absolutely does. And what it does is every week we get a new update. So it incorporates the trend from the prior week, incorporates that data, and then it incorporates policy decision. There's a statistical methodology. It's called R0 if you're a mathematician, and they adjust the R0 based upon social policy and trend. So it's absolutely incorporated.
Thank you, Laura.
All right.
Well, thank you. If you need to bow out, we'll let you. And if you want to stay on, please do.
I will let you get to your business, but thank you all so much for inviting me. And, our HealthWorks, if you know businesses, you can contact Lori Starnes at our HealthWorks number. I think the number's online there. Or you can just call me directly or email me, whatever. We'll find connection for you and try to help you to the best that we can. So thank you. Have a great day.
Thank you.
Well, thank you very much. I think that was very gracious of her to give us her time. And it's amazing to be in such difficult times and still feel so uplifted knowing that we have that kind of a resource, that kind of talent, that kind of commitment here in our community. And I would tell you again, because it is National Hospital Week, if you are so inclined, drop them an individual note or something just to let them know how important they are to our community. Randy, if you will pull up the next screen there, which is that. Aren't you just impressed? We went from not being able to get a meeting started to now you're going to see a PowerPoint. I'm just, we'll get good at this before we have to stop doing it. And if you can hit slideshow so that, there you go.
Which one?
From this present, yeah, there you go. So, and you can go ahead and go to the first slide. I wanted to put this up there. I know you've seen it 1,000 times, but to remind everyone, our mission is to grow the tax base. And, we do that through private investment, job creation, and all of the workforce development efforts that we go through. Basically, if we do well, we will create upward mobility and opportunity, and that's what it is all about. During COVID, it means we have to do what's not written up there, which is, and all other things as needed. And that covers a host of things. And if you'll go to the next slide. So the first thing I want to tell you that during COVID, I want to make sure that you folks know that the EDC has still been working mostly from home, and it's harder to do from home in a lot of ways. This is the first time that we have all been together since the work from home order was done. So it's kind of cool. I don't know if you've had that opportunity to be around folks in your offices just yet, but today is special for us. We're kind of considered frontline, essential workers, and not anywhere near like our EMS people and the health department and our fire and rescue and doctors and nurses, but still we've been still working here. We've been fielding questions about unemployment and sending Rick Smith and Wendy. Thank you guys for your patience with me. I've sent them all kinds of people who called here. We're still getting those calls. Yesterday I got one about 4 o'clock, Rick.